The first bone that we find in the lower limb is the femur, located in the thigh. The femur is classified as a long bone and consists of proximal and distal ends with a shaft or diaphysis in between. We'll start by identifying the bony landmarks that can be visualized on the anterior view of the right femur. At the proximal end, we have the spherical shaped head for articulation with the acetabulum to form the hip joint, and this is supported by a constricted area of bone referred to as the neck. As we move further distally, we come across the very large greater trochanter, which is located laterally, and the smaller lesser trochanter located medially. Both of these landmarks are present for muscle and ligament attachment. As we progress further distally, the proximal end narrows to become the shaft of the femur, and at the distal end we see an area demarcated on the anterior surface for articulation of the patella, and this is referred to as the patellar surface. The articulations formed by these structures, as I mentioned before, the head articulates with the acetabulum of the hip bone, forming the hip joint, which is classified as a synovial ball and socket joint. The patellar surface of the femur will articulate with the patella to form the patellofemoral joint, and this is classified as a synovial plane joint. When we move to the posterior view of the right femur, we can still see the head of the femur supported by the neck, as well as the laterally located greater trochanter and the medially located lesser trochanter. The shaft can also be visualized, but as we get to the distal end, we see two new landmarks, the medial and lateral condyles, which are for the femur to articulate with the tibia to form the knee joint. Above each condyle is a small projection of bone known as the medial and lateral epicondyles, and these are present for muscle and ligament attachment. The final structure that we can see on the posterior surface of the distal end is a slight depression known as the popliteal surface. This forms an area at the back of the knee where a number of important blood vessels and nerves pass from the thigh into the leg. So to summarize the joints formed by the femur, we've already looked at the hip joint formed by the head and the acetabulum of the hip bone. And at the distal end of the femur, we have the medial and lateral condyles of the femur, articulating with the medial and lateral condyles of the tibia to form the knee joint. And this is classified as a modified synovial hinge joint because it doesn't just perform flexion and extension, but there is also a slight amount of medial and lateral rotation possible at the knee joint.